The Affordable Care Act was designed to help prevent insurance companies from ripping off consumers. But like we've seen time and time again, the insurance companies have found loopholes that allow them to overcharge patients and to get away with it. Joining me now to talk about the latest insurance industry scam is Howard Nations. Howard, ProPublica did a great investigation on how the insurers are shifting costs to sick people because they're trying to make up money that they feel like they might have lost from healthcare reform. Lay this story out a little bit, if you would. Talk about that ProPublica investigation and what they found in that and what's significant to you about it.
Well, Pap, Obamacare never could have passed without the support of the health insurance industry because Obamacare prohibits denying coverage, and it prohibits it covers people with pre-existing conditions. It prohibits charging more for health insurance coverage, but the insurers signed off on that. But now there's a stealth problem that's been diagnosed by ProPublica, in that the insurers are charging more for drugs for HIV, for diabetes, for epilepsy, Parkinson's, and diseases of that nature, which they're absolutely not supposed to do. The scheme that they're using is, you always had in brand name drugs two categories of expenses. You had the non-preferred drugs, which were more expensive and the insurance companies didn't want to pay for, and they charged a higher copay, and you had the preferred drugs. Now they're doing the same thing with generics. The Affordable Care Act prohibits discriminating against patients with health care problems, but they're now figured out how to shift their cost to the consumers by classifying ailments as non-preferred. So the idea is that patients are supposed to have skin in the game. Patients should have to pay something, so you motivate them to proper use of the drugs, which is the whole idea behind copay. But in an editorial in the American Journal of Managed Care, they ask, how is a patient encouraged if all generics for their disease are non-preferred and cost more? So they're controlling it through the cost of the generics.
So Howard, the people watching this program right now, if they fall into one of these suspect areas that we know that this is nothing but a hustle. I mean, this is insurance industry again, hustling doctors, hustling patients, stealing in a way that they get their silk stocking lawyers to come down and figure out how to get around things. So now their silk stocking corporate lawyers say, well, that's real easy. If somebody's dying from Parkinson's disease, or if they're dying from HIV or things like diabetes, just put them in a certain class and try to make it look like we're not dealing with that we're not treating them differently because of pre-existing problem. Just say they're classed different, therefore they have to pay 5 times as much for drugs that the person next to them pays, and that they have to pay out of their pocket to make that happen. Isn't that kind of what I mean, in simplest terms, isn't that the new scam by the insurance industry?
That is the new scam, and it was recognized by Wayne Turner, who's an attorney with the National Health Law Program. He calls it a race to the bottom. Here's the other thing they're doing. They're trying to set up their plans, because they can't deny coverage for pre-existing conditions. So what they're trying to do now is construct their plans in such a way that they would be onerous to sick people to discourage them from enrolling in their plans, hence the race to the bottom. So their technique is to provide no preferred cheaper alternative. You have cheaper alternatives in brand name drugs. They're providing no preferred cheaper alternative in the generic drugs. And in July, 300 patient groups complained to Health and Human Services that these health plans are circumventing the spirit of Obamacare by excessive copays and having nothing but non-preferred plans, no cheaper choice.
So, but now we have a U.S. Supreme Court majority that, of course, that are going to support the insurance industry on this and probably say, gee whiz, you can't bring a class action against them. You're going to have to mediate, and in the mediation, explain what's going to happen there.
Well, in mediation, we know what's going to happen. They're going to go with the insurance industry. What's happened here is brand names. This is amazing because in this case, the brand name drugs are the ones doing it right. They lose patient protection. It typically, they lose patent protection when it becomes generic. Generally, generics would cost $5 to $10, and there were no tiers in generics. The trick now is that they've put this higher copay in with non-preferred. There was a study done on this. It was a totally stealth operation until it was discovered by a vice president of policy analysis who went in to get his own copay. He'd been getting the same drug for years at $5. All of a sudden, it's costing him $20 copay. He did an investigation. He found out, Pap, that this thing was so stealth that it was unknown to even the health policy experts. So the problem is that with the non-preferred drugs, they can pay copay of $10 to $15 more. And studies have shown that $1 difference in the cost of a drug can alter the behavior of patients. $10 to $15 difference is huge.
Yeah, in other words, they don't take their medication.
Right.
What about the doctor out there? Okay, you got doctor. The doctor's trying to treat somebody for diabetes. And then they're saying, well, in order to be treated for diabetes, you've got to do something. You've got to take your meds. And so so they say the insurance company won't let them get the meds without a 5 times the normal markup for those meds, so they don't take them. Doesn't this put pressure on the doctor to say, look, insurance company, you're telling me that I have a benchmark of results that I have to get, and you're interfering with my ability to get those benchmarks. Talk about that part of the story a little bit. It's amazing to me.
Well, this has always been a fascinating part of the story in that the insurance industry is now running the healthcare industry, and this is a fine example of it. Dr. Mark Fendick, who's at the University of Michigan, who specializes in value-based insurance design, says that this whole scheme of generic drugs with just non-preferred category is counter to this value-based strategy. Under this strategy now, the insurance companies are paying doctors for patient outcome. So if you have a diabetes doctor, he's paid based upon the blood sugar levels of his patients. They say if you are charging more for generics and that extra $5 or $10 on the prescription drug causes the patients to skip their drugs, then their conditions worsen. When they come back in to see the doctor, they get bad results. The doctors, therefore, are paid less on this value-based outcome. And this is what occurs when you have no preferred, cheaper alternatives. It's amazing. The insurance industry is absolutely running the medical profession.
Yeah, and the insurance industry in that case that you just described, they win on both sides.
Yeah.
Because the doctor can't raise to the level that they're demanding under their benchmark because the patients aren't taking the medication because the insurance company is charging so damn much for the medication, and the insurance company knows full well. They know the statistics that you just talked about. They understand the statistics are very clear that just $1, you almost start having a mass exodus if you increase their medication. But when you get up to 5 or 6 times the amount simply because somebody has HIV or diabetes or Parkinson's disease, again, until somebody goes to prison, until we start seeing these cats in striped uniforms in prison, nothing really changes. And man, you could round them up in the insurance industry. It would be very easy to get a whole busload of criminals.
You really could.
Howard Nations, thank you for joining me. These stories get more interesting as we watch Obamacare develop. We're going to find all kinds of scams like this. Thanks for joining me.